Hello everyone. Wanted to get back and follow up with Toni, 7 weeks out, post her first Bellafill injection. And Bellafill is the 5-year long-acting semi-permanent filler that gives you some volume, but it also changes the texture of the skin. So it stimulates your own body's collagen to improve and give you that younger, more youthful look. So look at Toni. So I want to show these pictures because this says it all. This is her before picture today, and this is taken. So she's going to look better. This is, like I say, 7 weeks out. She's going to look better in a month, better in 3 months, and continually improve and look more awesome in about 6 months. So we put 6 syringes in Toni's face, but I want you to look at her face, give you a little bit of facial anatomy history. So if you can see the changes. That is pretty equivalent to about 5 syringes. So we put 6 in her face, but I'm gonna look at her again in about a month, and I'm gonna add a couple more syringes. She needs a couple more right here in her mid-face area, and everyone always hates the nasolabial lines, and it's not always because of the volume loss here, it's because the mid-face needs to be tightened up a little bit. And I'm probably also gonna put a little bit more down in the lower face. So keep attuned, keep following us on Facebook to see the progression and improvement and how her skin changes with Bellafill. Also wanted to talk about today, because not only with what happens when we age, we lose collagen in our skin, we lose volume, we all have muscle action. And she asked me about these expression lines right here. In the glabella area, we call it the glabella. Some of my patients call it the resting bitch angry face. So these little guys right here, they're 2 muscles that actually push in, and there's a muscle in the middle that actually pulls down. So when we smile or frown or make that stern, concentrated look, some of us create the number 11, some of us create the number 3, some of us create the 1 line in the middle, but you can see exactly how these muscles push down. Toxin, which is like Dysport, Botox, and Xeomin, is a medication that you inject into the muscles. It doesn't kick in immediately, but a lot of patients think that it fills the skin. It does nothing to fill the skin. It relaxes the muscles so you don't make the expression. And also, if the person is a great injector, you use it as a counteraction mode. So what I was showing you with the muscles that push in here, and this little guy, the procerus muscle that pulls down, when you relax this area of the face, the forehead muscles are trying to pick up, so she'll get a little bit of a central brow lift. So that will help her see better, that'll give her more of those arched brows, and it will actually soften the forehead wrinkles a little bit. Very conservative when I'm injecting someone's face. Always like to inject the glabella area first, which is this area. See the kind of counteraction you get. And a lot of patients do need some injection in the forehead muscles as well. Toni has that little bit of volume loss in here, which we're trying to correct. And we did put some Bellafill in there to correct the volume loss around here. But I want to inject here just to show you how quick the Botox injection is. It's essentially doesn't hurt. It's a very teeny weeny little insulin needle. I'm going to clean her real quickly with alcohol, and then I'm going to let her ice it up, and it'll show you just how quick this procedure is. It takes I'm using Botox today. It takes Botox, for me, it's an average about 5 to 7 days to kick in, and technically we have to say it lasts about 3 to 4 months. Some patients get longer results. I'm gonna chill the area for you. This is just a little glass chili ball. He was in the freezer, so I just chill her here for a second. There's not really a lot of downtime with Botox. I just tell patients to be a little cautious. Do not rub or massage the area after the procedure. It takes about 4 to 6 hours for the medicine to kind of settle where it needs to. So I tell patients, we really wouldn't exercise or turn your head upside down or do any acrobatic maneuvers for the rest of the day, just to be on the cautious side of it. I'm going to tilt her back just a little bit. So you pinch the little muscle up in the middle. We'll put a little bit there. Like I say, I'm gonna just put a little bit in that corrugator muscle there. And depending on the way that the muscles are behaving, you may get a couple more injections. Her muscles aren't that, the corrugators aren't that horrifically strong, but essentially that's it. That's the Botox injection. It takes me longer to talk about it than it does to do it. Did it hurt?
Not at all.
And it's minimal chance of bruising, but occasionally, obviously when you're sticking someone, you can have that possibility for bruising, but stay tuned. We do, Tony's reminding me, we have a Botox day coming up in July. Can't tell you when, so you're going to have to stay focused and watch our emails. A special Botox day with extra special pricing, and I'm going to give you a free, we have a new Sente product. Amazing new scientific medical grade line. It's I'm going to give you a free eye treatment with that product. So you probably need to RSVP for that day, so stay tuned. Hope to see you for Botox Day, and stay tuned for Toni's follow-up of Bellafill. The next time I'll probably inject some more Bellafill into her face. Have a good one.
Can we put a little here?
Yep.
I just clicked the live button again, right, and turned it off.
And you were awesome how you told her to turn